helicopters. I know enough to be dangerous, but I'm not an expert. I'm not a pilot, and I'm not a doctor. So I just want to get that clear. But thank you very much for coming. For your information, apparently this event has been live streamed via Zoom virtual meeting, as well as broadcasted on Pemprov, PKI, Jakarta, and Bank Indonesia YouTube channels. So behave. Yes. This session will be conducted in English. Saya berasal dari Skotlandia, so I apologize for my accent. For your convenience, interpretation devices are available at the desk near the entrance, or you may ask the staff in the room to help you. As we prepare for the event, please kindly request switch off your mobile phones or put them to silent to ensure smooth progression of the program. So thank you for cooperating on that. Now, apparently, before we start the discussion, please share with me one word that comes to mind when you heard the word medical tourism. You can participate in answering this question by scanning the barcode displayed on the LED screen right now. Did I get that right? Yeah? Where? Oh, okay. So, one word that you associate with medical tourism. I'll tell you my word, wellness. Okay. Maybe someone else has got some word. Just as a bit of a background, while the words are coming up, Indonesians spend anything between, depending on the report, between 8 and 11 billion US dollars a year overseas on medical tourism. And that probably excludes other expenditure they make when they're overseas, getting medical attention. 65% of all private insurance claims in Singapore are Indonesian. 80% of all the cancer patients at island hospitals, the specialist cancer clinic, are Indonesian. This is one of the countries in the world which has the largest outflow of patients from their country to another country. So here's some of the words. Advanced technology. Well, obviously we'd like our hospitals to have very good technology. Comfort. Wellness. Difficult. Could be. It's difficult here. Revolution. I've got one of our chief commercial officers here, marketing. Revolution, Harmeni. That's a word you need to get your head around. Rehabilitation, yes, it's a key component for medical tourism, and particularly in a place like Bali. Affordability, cheaper, hopefully cheaper than Singapore. Malaysia is very competitive. Quality, absolutely. So wellness and travel. Okay, so these are the main words that are associated with medical tourism. Just to explain some of the background about the challenges the Indonesian healthcare industry has in terms of losing revenue to neighboring countries, particularly Malaysia, Thailand, and Singapore. Hopefully today we'll cover some of the topics that will help address that, because it is a real challenge for Indonesia to try and catch up with their neighboring countries. And that number I gave you is between 8 and 11 billion. That's increasing every year. The flow has not been reversed. It's only getting worse, actually, from an Indonesian perspective. So, what we want to do in this session, we want to understand how to attract global participation in the healthcare sector. So some of the stuff we'll be discussing is, let's discuss the outflow of medical tourism and how we start to get that back, particularly the existing market for medical tourism development in Indonesia, and I've told in Jakarta. The question I have for the team here is, if you look at where medical tourism is overseas, Bumrungrad Hospital in Thailand. Thailand's an established tourist destination, never mind healthcare. Island Hospital in Penang. Penang's an established tourism destination, never mind healthcare. And Singapore is Jakarta, an established tourism destination. Bali maybe, but I'm not so sure about Jakarta. Challenges and opportunities in that system, in establishing medical tourism ecosystem in Indonesia. What sort of complementary services should we be attracting? What sort of complementary clinics should we be attracting? I think one of the speakers will deal with that. Best practices on establishing an international hospital in Jakarta. I think someone's going to do a case study. Our company is establishing an international hospital in Bali. We have 5 hospitals in Jakarta, but we're not yet there international standard, but we will be one day. Okay, so what I would like to do now is invite some of the speakers to the table. The speakers, by the way, were changed. Some of them were changed at the last minute, so I hope I get the names right. First one I'd like to invite is Dr. Dwi Otavia. She's the Deputy Head of Department of Health of the Jakarta Provincial Government. Dr. Dwi, you can sit here. Then a company I know very well, and the representative is Mr. Bobby Mandala Putra. He's the Director of... Give them some encouragement. Thank you very much. So what we want to do now is we're going to ask each of them to just to present some themes for about a 10-minute period. Then after they've finished, we'll invite some comments from the floor and then go into a full Q&A. I do hope that many of you will participate in the Q&A. And just before we start, I think it might help our speakers if we understood the profile of the audience. So can a show of hands for those of you that actually work in hospitals or healthcare? How many people work in hospitals and healthcare? So maybe 20%. How many work in government or policy related to healthcare? A couple over there. How many work in pharmaceuticals or healthcare services? None. Okay. And how many are involved in consultancy relating to healthcare? Okay, a couple over there. So that's good to know just a little bit the profile of the audience. So the first speaker will be Dr. Otavia. Dr. Otavia earned a master's degree in epidemiology from the University of Indonesia. She recorded a long list of experience in the Jakarta healthcare system, including as a director of regional hospital RSUD at Johor Bahru and the head of disease prevention and control department for health of the Jakarta provincial government. Through her outstanding career, she now serves as the deputy head of the Department of Health in the Jakarta provincial government. So she's someone there's a hospital group we have to work with very closely and collaborate with, particularly in areas like prevention. So Dr. Otavia, I'd like to invite you to start your presentation.
Thank you very much for the introduction. I'm honored to have the session with you all. As requested, I will present about the accelerating Jakarta's transformation as medical tourism hub, but maybe my presentation is not just limited in the medical tourism area, but maybe some other issues that maybe can be raised in our discussion later. Oh, okay. Yeah. This is the clips of the health facility in Jakarta. So we have this around 190 hospitals in Jakarta, and we also have around 2,000 clinics, private clinics, and also our public health centers or puskesmas. We have 44 at district level at kecamatan, and also 292 at sub-district or kelurahan puskesmas. So we need to understand that not just hospital, but also this The task of the clinic and the puskesmas has also a great burden where they have to do intervention program, screening program to prevent the disease comes to Jakarta people. But for hospital, the emphasis is on the curative, means that lots of effort to cure and to prevent from disabilities and also to reduce mortality will be the burden at the hospitals level. And the nowadays we also have set a new approach to reach the prevention sectors, means that at puskesmas or at the public health center, we have this new approach to integrate the screening at all stage of stage of the people in Jakarta. Next, please. In transforming its health services, then we developed master plan also in transformation. For health transformation, we started at 2023. It's quite the same with what the Ministry of Health has, and also we work side by side with them. And to realize this goal, of course, it is supported by various pillars, including health referral services, digital technology pillars, collaborative governance, and human resources, all of which are closely related to effort to develop medical tourism. Slide. And the vision of the health office for slide, please. Yeah. The vision of the health office for improving the quality of healthcare facilities, not only in terms of supporting the medical tourism, but overall is as follows. We focus on prevention, patient-centered care, data analysis-based, integrated mobile application, human resources management, and new health service model. Related to digital technology, we focus on improving its capabilities as integration services, data fabrics, infrastructure, hybrid cloud, platform digital, and artificial intelligence used in the health service in Jakarta. Next. The Jakarta as a metropolitan city, we have all these complexities, and I think we all understand this situation. Very heterogeneous citizen, there's various health problems. We have infection, communicable and non-communicable disease like diabetes mellitus, hypertension, chronic heart disease, and others. And also we have these malnutrition cases, not just undernourished for children, we still found them, but also the obesity are also become very challenging now, including the rising of mental health issues. As any other big cities, I think these issues becoming very popular right now. And how the health office organize latest approach to the community with integration or primary health services like the screening to more white citizen in Jakarta to be able to have the services like the screening program. Next, please. And yeah, the Jakarta provincial government continues to be committed to supporting the provision of various infrastructures and budgets for the realization of inclusive quality health service for all its citizens. Like we have the infrastructure facilities, asset mutation and land development policy, collaborate with other departments of land use to develop the hospital tourism at Pasar Minggu Hospital, like one of our projects now, and also with other department, also with Department of Education to have the land use to improve the Tarakan Regional Hospital areas, and also at the medical device, we fulfill the sophisticated health equipment that support complete or main level or superior services. and also support for medical equipment grants from the central government and private sectors. For staffing at the hospital of the human resources, their recruitment policy according to service needs for hospital center of excellence, increasing competency through central government or regional government scholarship, monoloyalty and redistribution of health human resources, doctor proctorship program for special services and others. Next. And why we need to invest in Jakarta? I think the advancement of medical facilities in Jakarta, maybe I can say one of the best services compared to other Indonesia. Maybe side by side with Bali, yeah, with the newest health investment and also the modern hospital, many of which have international accreditation. Hospital like big chain hospitals also have this more competitive these days. And skilled medical professionals, the city has a large pool of well-trained doctors, specialists, and medical staff, many of whom have received education or training abroad. And also with the Cipto Mangunkusumo Hospital, offer high quality medical care with advanced technologies, and we also have this uh, partnership with the vertical hospitals to improve the quality of regional hospital owned by the government office, the Jakarta government office. And affordable healthcare medical treatment in Jakarta are often more cost effective compared to many Western countries or many other big cities, international cities, making it an attractive option for international patients seeking quality care at lower price. Maybe that also comes out when we have this Slido presentation at the introduction of our discussion. And also international accessibility as Indonesia's capital and largest city. Jakarta has excellent international air connection, making it easier for medical tourists to travel from around the world to Jakarta. Next, please. And the development strategy for Jakarta's medical tourism, I think we can see at these four groups: the compliance for hospital medical tourist standards, from the services competency, the staffing of hospitals, the medical equipment, and also from the promotion, how we promote and engage with tourism board, and the brand awareness of the hospital, regional hospital, and also making lots of events to promote the Jakarta medical tourism programs. And for the Tourism and Creative Economy Office also collaborate with the health department to develop the Jakarta medical tourism, and also with transportation, the hub, so that not the hospital is easier to reach, and also we have this other ecosystem that support the hospital tourism. And also we partners with big chain hospitals, with travel agencies, with insurance companies, and also with other ecosystem support like hotels and restaurants. Next, please. So that the opportunities, the opportunities for investment may be the first, the hospital clinical services for health tourism. Yeah. Like international standard hospitals and established specialized centers of excellence, maybe to create comprehensive medical tourism package with agencies, with travel, and also with other maybe MICE sectors, and also creation of integrated medical tourism complex. Next, another opportunity is in digital transformation in healthcare. Nowadays, we are still developing this EMR, as it is also an obligation from the central government that we need to have this interoperable system, and also the telemedicine platforms. Due to COVID, we have quite lots of experience of telemedicine platforms that now we can continue the services, and AI-powered diagnostic tools, and health monitoring system, not just for hospital patients, but also for prevention, for screening programs. We now use the AI approach, and also with blockchain solution for secure health data management. And the third, in genomic and biomedical labs, maybe this is also one of areas that could attract investors, like the establishment of advanced genomic labs or genomic services, development of precision medicine facilities, biobanking, and genetic data analysis infrastructures like that. Next, please. The health human resources and research also maybe can attract investors in health from development, international medical training centers, collaborative research facilities, and also specialized healthcare works development programs. And for public health resilience, now we also develop an advanced infectious disease control centers, and we can develop integrated public health data system and also establishment of climate resilient healthcare facilities. Next. So in conclusion, Jakarta is open to investment opportunities in the healthcare industry, maybe not just in hospitals, but also in other areas that could attract investors and also to improve the healthcare system in Jakarta. Jakarta continues to improve the quality of health services and fulfill competent human resources, and also development of the quality of Jakarta residents to make Jakarta a global city is also becomes all of our obligation to collaborate to these issues. Thank you very much.
Thank you very much, Dr. Otavia. You covered a lot of ground there in precisely 10 minutes, so well done. You stuck to your timeline. She made a couple of very good points, particularly about the investment opportunities in other related sectors within the healthcare supply chain. That I think is a missed opportunity for a lot of investors. Not many of them are doing it. And just so you're aware, for foreign investors in hospitals, the regulation is still somewhat restrictive because foreign investors technically cannot invest in Class C and Class D hospitals. So it's still relatively restrictive, only Class A and Class B. So if you're buying into a portfolio, there's other mechanisms you have to work around in order to be able to do that. Because inevitably, a portfolio will include all types of different hospitals. We're pointing that out. And the other point that struck me there was Indonesia doesn't have a first-class nursing school in the entire country. Nursing in a lot of countries is a tertiary degree. Here it's not. And just from the human capital perspective, that is, in my opinion, a great opportunity for someone who operates or a company that operates a nursing college, but a real pressing need right now in this country. So we're now going to move on to someone who's going to tell you a story and sell you an investment. And this is Bobby Mandala Putra. Bobby Mandala Putra, as I mentioned before, is the finance director of PT Hotel Internasional Sanur, a subsidiary of PT Hotel Indonesia Natur, or the InJourney Hospitality Group. PT Hotel Internasional Sanur is currently developing the hospitality aspect in the special economic zone for health and wellness in Bali. And actually, they are the master planner. And as I mentioned before, they are the landlord of the land that we are building the hospital on. So, Bobby, I believe you're going to try and explain the benefits of the special economic zone.
Yeah. Thank you. Thank you. Can I starting to describe the special economic zone in Sanur? Good afternoon, Bapak Ibu sekalian. So, who we are? We are a member of InJourney. Member InJourney to become InJourney ecosystem. So we create ecosystem in Sanur, through the special economic zone. The vision of InJourney to be leading tourism ecosystem in the region, providing memorable experience through Indonesian hospitality. So we create a synergy through holistic, inclusive, and collaborative approach. Holistic, comprehensive business visibility, point of view, not per component or silo. Inclusive, include all components of the value chain in the development of tourism solution. And then collaborative is able to involve stakeholder component, broadly not limited to companies of holding. Next. PT Hotel Internasional Indonesia, established since June 9, 2023. PTIC as a special purpose vehicle to operator the Sanur Special Economic Zone in area. So we subsidiaries of Injuni Hospitality, member of Injuni Group. We have two sub-unit business. The first operator in Special Economic Zone, and the second owing company. We have a hotel, Balbis Hotel, the memorable and the legendary hotel in the Sanur, Bali. And next we build a premium villa. So we supporting in the special economic zone in accommodation and the infrastructure. So the patient can get medical tourism in the special economic zone. Okay. Next. Okay, this is why we create the special economic zone in Bali, because based on data, Indonesian netizen travel abroad for medical service above 70% of them are middle class tourists and above, and or equal to 6.8 billion US dollar estimated total Indonesia loss in 2019, one of the largest in the South Asia. Based on the data, so we create the special economic zone in Bali. So we want to create the special economic zone, become the world-class medical and wellness center, the most integrated medical and tourism facility, and then the rest are located in Bali because the variety tourism in visit in Bali. Okay, the key of why the create special economic zone, as Lee mentioned before, that the wellness in the Southeast, in the Southeast Asia, we can see that wellness tourism, like the Amantara Wellness Resort, with the medical tourism, Bungrat Hospital, and then the Shangri-La Resort and Spa, with the medical tourism, Pantal Hospital Penang, and then wellness tourism in Capella Hotel Singapore with Mount Elizabeth Hospital. So, because Sanur Bali famous in the wellness tourism, so we create the special economic zone in Bali. And then the Bali is the international many diversity tourists in Bali, visit in Bali, in the data, Asia, Europe, Oceania, ASEAN, United States, Africa, visit in the Bali. Next. Okay, this is the ecosystem what want to we create in the special economic zone in Bali. So we collaborate with Bali International Hospital, and then we built ethno-medicinal botanic garden, and we support with the accommodation, the luxury hotel, and then the 3 or 4-star hotel. And then we create also commercial, and then the patient can also visit the beach. So so for the recovery, the period recovery, the patient can visit the botanical garden, or can visit the beach in the near area of special economic zone. Next. This is the plan for world-class medical and wellness center that we want to create. Our value professional, we collaborate with top-notch brand, best technology medicine, expertise, and seamless experience. For the hospital, Bali International Hospital, as I mentioned before, that have 6 center of excellence: cardiology, gastrohepatology, oncology, orthopedic, neurology, and obgyn. We can call it Congo, Congo, yeah. And then we collaborate with aesthetic plastic surgery, regenerative medicine, rehabilitation center, traditional medicine, geriatric, fertility treatment, diabetes center, and eye treatment. For the specialty, yeah. Okay, next. This is the benefit, significant benefit and synergy from Sanur Special Economic Zone. The first, granting medical license and work permit for international doctor and nurse. This is the regulation has been sent by the minister, and then exemption of medical equipment by custom. We have a custom in the area of Special Economic Zone, providing regulation relaxation of medical service and the use of world class medical technology in Special Economic Zone, providing additional doctor medical license who serve in Special Economic Zone, creating end-to-end patient journey. This is why we create Special Economic Zone. So we want to creating end-to-end patient journey from patient come to hospital or clinic until check out into the hotel, and then providing holistic leisure, wellness, and healthcare ecosystem. Ease of use of foreign insurance facility for payment of hospital service in Special Economic Zone, granting approval for foreign investment, exemption from general and special hospital criteria regulation class A until D. Ease of use imported drug that have obtained approval from their home country. So we can import the drug, but the regulation have to approved by the home country first. So we can import the drug, and then providing smart complex area, and the last providing eco-friendly zone. Okay. This is the area, map area Special Economic Zone in Sanur, UMKM Center, Commercial Space, Bali Beach Convention, Bali Beach Hotel, The Meru Sanur, Rium Villa, Long Stay Resident, and then Eye Center, Fertility, Ethno-Medicinal Botanic Garden, Cell Therapy, General Hospital, with the Bali Internasional Hospital, Stem Cell, Aesthetic Plastic Surgery, and Geriatric Elderly. The operation of hotel already done in March 2024. We operated the hotel, 5-star hotel, and then the next Bali International Hospital, and then the clinic. Okay, this is the Sanur feature that want to be fit in the Sanur Special Economic Zone. Smart Complex, one-stop service application, integrated seamless service, integrated building management system, smart command center, integrated patient data record, and then end-to-end patient journey, provide service pick up until check out, integrated lobby, integrated payment system, corporation between clinic and hospital, hotel as recovery room, eco-friendly zone, low emission zone, EV vehicle, dedicated waste management, area for recycling, wastewater treatment plant, solar energy coverage, holistic leisure wellness and healthcare ecosystem. We have convention center, 3 restaurant, commercial area, wellness recreation and activity at ethno-medicinal botanical garden. Benefit from Special Economic Zone, tax and import duty benefit, access to international drug and medical equipment licensing, foreign and doctor and nurse. Integrated healthcare area, world-class medical facility and clinic in one area, recovery area and activity, hotel, access to ethno-medicinal botanical garden. Okay, thank you, Bapak sekalian.
Thank you very much, Bobby. Just to put a couple of things in perspective about where the economic zone should really add value. I'll tell you a story. In August of this year, I was back in Europe and I held a number of roundtables with Indonesian healthcare diaspora. Some of them were very, very senior, been working in Europe for 20 years, senior cardiologists, the head of a nursing school. And I was telling them, your country needs you. We need you back. We need to improve the capability here. And they all asked me very similar questions. One was, can we be assured of getting access to the right drugs? And that's still a problem in this country, but in the SE, the special economic zone, there is sufficient flexibility. Can I get a license to work? Because historically, they couldn't, or they could if they came back and went through a whole new accreditation program, and it's very unattractive. Will I be supported by high quality technicians and nurses? This question came up many, many times because they're used to working with high quality nurses and technicians, and most of these people were in Germany, Holland, and the UK, the ones I spoke to. And will I be working for a hospital director who has genuine international experience? So these were the questions I got. They didn't ask me about the salary because they know if we're running a good hospital and we're able to attract the right type of patients, we'll be able to afford. But these were 4 critical points that came up. And right now, in theory, only in a special economic zone can these criteria be fulfilled, with the exception of the nurses, which we're working on. But only in a special economic zone can these criteria be fulfilled. So I just want to mention that because outside of Indonesia, there is a huge Indonesian diaspora talent base. Huge. Some very, very highly qualified people. And we want them to come back. But hitherto now, it's been quite unattractive for them. So I think I had a meeting with your Deputy Foreign Minister and your Healthcare Minister, and we discussed this. This is something we need to try and work on strategically to try and bring back this talent to build up the skill base. And only in Sanur can we do it. That then takes me on to our next speaker. That's Dr. Harmeni Wijaya. Dr. Harmeni holds a medical degree from Trisakti University and a postgraduate program in health communication at Harvard Medical School. She is a distinguished career in healthcare management and has held senior positions in several leading private hospitals in Indonesia. Currently, she sits as a Chief Commercial Officer of Indonesia Healthcare Corporation. That's the group that has 37 hospitals in Indonesia and is developing the hospital in Bali. So Dr. Harmeni, I see a lot of you. Welcome.
Thank you.
Carry on with your presentation.
I think I'm more comfortable standing up and present. Thank you. But I don't want to block anyone, so I will just stand here. Good afternoon, everyone. I recognize some of familiar faces here. Thank you for coming here. This is critical hour, yeah. So maybe any of you are sleepy now? Yeah. This is after lunch. Postprandial somnolence. I'm a doctor, so I can diagnose, but yeah, I don't take patient anymore. So I'm Harmeni, Dr. Harmeni. I'm from IHC, Indonesia Healthcare Corporation, and this afternoon I'm going to talk about our key initiatives in elevating healthcare standards and global accessibility. Okay, so this is the profile of IHC. We are a state-owned healthcare company which covers all regions of Indonesia. Currently, we have 36 hospitals, and soon we will have 2 additional hospitals. With one will be opening last quarter of 2024, which is a Panorama Hospital in Balikpapan. We are preparing to with the operational of IKN, yeah, the new capital city of Indonesia. I think our Class B hospital there will get referral of more advanced cases from the IKN. So we will have another hospital in Balikpapan. And the other one is the most anticipated hospital in the country, Indonesia, which is Bali International Hospital. Thank you, Pak Bobby. You explained some of Bali International Hospital already, so maybe I'll get discount all the time. Yeah, so on top of the hospital, we have 66 clinics. So overall, we have almost 5,000 of hospital beds with over 1,000 GP doctors and 1,500 specialist doctors. Next. Okay. So, with this opportunity, I think I would like to highlight the background of medical tourism and why moving forward we have to work more on it. Because currently, maybe I will restate what Pak Bobby stated earlier. We are spending a lot of money overseas, yeah, for the healthcare services that Indonesians got from other countries. So, 2 million of Indonesians choose to seek medical attention outside of our country, and 60% of them actually go to neighboring countries, yeah, in Southeast Asia, like Singapore, Malaysia, and Thailand. And the cost is as high as whopping 11.5 billion US dollar or 160 trillion Indonesian rupiah. What are they looking for in this overseas healthcare services? We've got some analysis, and the research shows that most of the healthcare services that they are looking for are medical checkup, dental services, aesthetic and beauty, advanced procedures that are not available in Indonesia yet, ophthalmologist, and also fertility. So IAC has done some key initiatives. We are still on progress. Yeah, we are working on it, and I think by having international partners, international strategic partners, it somehow can help us accelerate this initiative to build the medical tourism in Indonesia. So it's all about the commitment to growth and excellence of our medical services. The first initiative will be develop our comprehensive healthcare facilities. What can we do for this one? So the first thing is we are trying to upgrade our healthcare facilities. We are trying to have the medical equipments that are not available before. So now in oncology or cardiology, we have advanced services already in IAC. So new procedures like robotic has already adopted in our hospital. And secondly, we also partner up with international institution. Why? Because as Ansley said before, I think our nursing school has not reached the capability of international standards. So currently we are partner up with Sing Health. We actually sent out our nurses to study there and then to get the upscale. In the future, I hope IAC can provide what other countries are providing right now. So in the next future, hopefully we should be in a comparable state, yeah, of medical services. Okay, the next is strengthen our healthcare workforce. Maybe training is one of them, but on top of training, I think government and maybe private sector should invest more on the research and development, because that is actually part of capability building that we need to work on, and we need to open our eyes why we cannot provide yet something that other countries provide. Next is enhance the accessibility and infrastructure in our country. We know that a lot of cities in Indonesia don't have proper transportation yet. So I think we need to work on it, the transportation system, as well as the hospitality services. If we want to build medical tourism, I think it is sensible for us to have a good hospitality services in Indonesia. The fourth key initiative is leverage with technology on top of telemedicine, yeah, like Bu Dwi Octavia said before. I think we also need a good, solid digital platform that we can use to accelerate our efforts to have this medical tourism. How medical services as well as hospitality and also transportation for other region of or other countries to get Indonesia can be done seamlessly in this digital platform. The fifth one is branding and marketing. So we are trying to partner up with ITBC, Sanur, and then the Ministry of Tourism and creative economy. So how we introduce Indonesia, how we are also introduced that we are going to have Bali International Hospital with a lot of diaspora doctors and also foreigner doctors that can practice in Indonesia. And I think 2025, we cannot be shy anymore. We have to go out. We have to learn from other countries why they can have medical tourism campaign, medical tourism event or something in other countries, and we haven't done it yet. So I think in 2025 we should do this. Okay, next. These are the obstacles that we are currently have, and I think we need to address these challenges. It is a weightlifting for all of us, but I think with a great partnership between PPP, yeah, public-private partnership, we can overcome all of these obstacles. The first is regulatory barriers. We know that some of the regulatory hurdles somehow hinder the advancement or investment in Indonesia, and I think that is something that we have to focus on. Second is the quality and standards of our medical services. Third is the logistical issues. Fourth is cultural and language barriers, because with different cultures, of course, people will have different expectations. We have to understand if you want to capture the market from, let's say, Middle East or the emerging European tourists now that come to Indonesia, and maybe they will seek for medical services at some point. We have to know their culture. We have to know their what is normalized in their country for the medical services. And the last one is competition from other countries. How we have more competitive price with the same quality, something like that. Okay, next. Okay, we have taken action for those obstacles, and this is one. This is some of them, and I will make it quickly, yeah, because I'm running out of time and I'm nervous now. So we first we will work with international accreditation bodies for our hospitals. That's why the services will be standardized. The second one is implement the quality control and continuous improvement programs. It will help us to be consistent in providing good quality of care. Next is streamlining regulations. I think it will be more with the government. So how the licensing process for medical tourism services can be simplified and streamlined by our government, because somehow we still met this kind of hurdle in the process. And secondly is to collaborate with stakeholders, how we can create a clear regulatory framework. Next is a strong partnership with the global insurance companies. We have approached them how they will cover the medical expense in Bali International Hospital, and also they expect us to provide some kind of extra services as B2B, and I think it's normalized in the business, and we've done that already. The second is to engage in cross-border collaboration for research and development. So currently, we have engaged with Mayo Clinic for the knowledge sharing, and also for the medical upgrading. And also the newest one is we are collaborating with Karolinska University from Sweden. So it will somehow upgrade the skill and capability of our doctors and other healthcare workforce. The next is cultural training and language services. So I think we've done some market analysis, and we realized that a lot of tourists are now based in Bali for longer period work from Bali, yeah, and how they seek for medical services, but somehow the obstacle of these communications and the language and also cultural stuff is didn't meet their expectations. So we are working on it. Next is enhancing logistic and accessibility. I've mentioned before, so we can skip it next. Okay, so this is actually the things that will work for us to make a dream come true. To have medical tourism, the well-established medical tourism in Indonesia. I think the government and private sector will work hand in hand to make it happen. We will need support from government, be it central or local government, and also we need regulatory support and capacity building. What we can have from central government is the funding and incentives to develop the world-class medical services. So I think the government can start with the vertical hospital or SOE hospital like us, how we can have medical equipment as well as facilities for some procedures that are not available yet, like some robotics, some transplants are not available here. So in the next future, hopefully we will be able to have it. Next is national campaigns for promoting Indonesia as a medical tourism destination. I think it's not the responsibility of only tourism ministry. I think we will need a lot of support from other ministries as well. And the next is the policies to attract foreign investment. Like Ainsley said before, I think the regulations should be more loosened up if we want the infrastructure to help us grow and maybe upgrading for the Class G hospital to be the Class C. Okay, from the local government, I think we will need support for the development of healthcare infrastructure, how our hospitals should meet the international standard. Second is the tax incentives. I don't know if there are actually audits from local government that can support this, hopefully. And the last one is the integrated package for medical tourists. I think we will have to create some attractive package, like for the hospital expense, and then for the hotel expense that they are going to pay. I think the attractive package between healthcare and hospitality will attract medical tourists easier. Next is the regulatory support. With a clear framework, I think it will be more supportive and streamlined for medical tourism initiatives. And then fast track visas, because we want everyone to come to Indonesia easily to get medical services here. So I think our government needs to work on it. And last thing is the PPP, public-private partnership that I've mentioned before. And the last thing is capacity building. I've also explained before, so we can skip it next. Oh, time's up. Okay. So I will introduce BIH, Bali International Hospital, quickly here. So we have basically clear vision, essence, and core values and culture traits. So we want to offer a healthcare experience like no other. It's something that's not available before, and with the right support and the right place, I think it will be soon for us to have such international hospital in Indonesia. Next. So this is the snapshot of our hospital. We have nice lobby, actually, very attractive with standard services, and we also leverage on the natural beauty of Bali. So we have garden and also green space. Next. I think we can skip this. It's already part of what I've mentioned before. So what we can offer in Bali International Hospital is actually quality of care with the set of doctors team that will be practicing in our hospital. And secondly is timeliness of care, which is still rare in Indonesia. A lot of people actually told me that they went out of Indonesia because they get a medical checkup result very quickly, even in the same day, which is maybe not possible in some of our hospitals. And convenience of care with the service culture in Bali, I think it will offer somehow convenience for the medical tourists to come to Bali. Next. Yeah. So I think that is for me. So feel free if you want to ask, or maybe if we don't have enough time, you can ask the committee and they will collect the question for me. Thank you very much.
Thank you very much, Dr. Harmony. Thank you to all the speakers. I understand there are a number of representatives from Mayapada Healthcare Group here today, and I've been asked to invite one of them to respond or to give their comments based on what they heard. So I think Dr. Jeffrey Tobing, would you like to give your thoughts? Dr. Jeffrey Tobin, you're in charge of business development?
Yeah, right.
At Mayapada, yeah.
Okay, thank you. Thank you for the presentation that's already you present to us. For us, Mayapada, for the private sector, we also you have one hospital in SEZ in Batam. Maybe around 2 years. And then, but the flagship our hospital right now in South Jakarta, Mayapada Hospital, South Jakarta. So, based on your presentation, Dr. Harmeni, I want to ask about how the strategy from your company to set up many hospitals in many areas, to choose about the good area based on your company to set up that new hospital. Okay, and how to decide about the design and about the medical equipment, and until you set up about the center of excellence in the hospital, especially maybe Bali International Hospital. Yeah, because we know that it's not easy to get about SEZ in that area, and we know that many effort that from your team to struggle until we get about the peraturan pemerintah, yeah, about the PP. Because right now, my father until now still waiting about the PP. At least we can get about the PP on this month. Maybe it's the first question for you, Doc, about the strategy. And maybe Doc from Dinas Kesehatan. Right now in BSD, we will have SEZ also from education and healthcare, and we'll hospital in that area under BSD group, right? Nah, if in Jakarta, yeah, Doc, the government support private sector like my father to make it like that. Because of what? Because we can for us private sector healthcare, we cannot always ask to central government like Ministry of Health to help us to make any some things like make easy, maybe like easy for help us for how about the tax and for the medical equipment or for the drug more easy to our hospital. That's why the strategy and the best way with the best way, if we want have good medical tourism in Jakarta, the strategy is make SEZ in Jakarta for healthcare.
Just make the whole city a healthcare SEZ.
No, not all city.
Oh,
Maybe
why? Not just your hospital, everyone else's. Everyone gets the benefit.
because right now, if we see BSD already built at least not more than 15%, right, about the area, and after that after they finish 50% built about the building, after that and resident, after that they propose to Kemenko, yeah, support by regional government to get about that SZPP. How about if Jakarta support the private sector like my father to get about that PP in South Jakarta? Maybe we can discuss if from the Dinkes interest. Thank you.
Okay, thank you, Jeffrey. Actually, it's interesting from a foreign investor's viewpoint. We wonder why you need to do SEZs. You need to upgrade the entire healthcare ecosystem, and the great benefits in the SEZ. But for Indonesia to be able to catch up, we're just wondering why you just don't give the same benefits across the entire sector to encourage much more rapid development. And in an SEZ, the very definition of an SEZ typically means you have to go and actually build a new facility. But my father operate many of existing facilities. We do. Many companies operate existing facilities. Why don't we get the same benefits in the existing facilities to help us upgrade and invest? So that's from looking from the outside in. You think Sanur is great, helping us a lot, but if you want to catch up, spread the love across the country. not just in an SEZ. Because the SEZs can only make a very small difference. The Sanur SEZ is what, 40 hectares. There's one hospital, 5 clinics, roughly. Even BSD SEZ is not that extensive, right? Batam as well. They can only make a small difference. We're talking 250 beds. I don't know how many you have in Batam, maybe with Apollo, maybe something similar. So in the overall scheme of things in Indonesia, the number of beds provided in an SEZ is just the tip of the iceberg of the overall healthcare ecosystem. And I think that's, to your point, I think something maybe the regional government can think about if you're really wanting to attract more investment. Would you like to respond? That's my thought.
Thank you. The ideas of what the special economic zone, like we have in Sanur and also in BSD, in Batam.
And also based there.
In BSD. Actually, we already have some discussion about it maybe 1 or 2 years ago. And because we are not yet set up the standard in the indicators or others, especially for the healthcare sectors, then yes, it is not yet more discussed yet. But it is possible that in the future we can learn from Bali experience and also from Batam. And for the area in Jakarta, not yet as an SSZ, but close to the ideas to that is what we want to build around the Pasar Minggu area for the hospital tourism area, because the ecosystem for not just for the health, but for the also for the tourism attraction area and also for the transportation, transit transportation is already set up there. But for other ecosystem support for the health tourism not yet established. But maybe the ideas of what we can learn from Sanur and also from Batam, we can have more discussion about it. Like what Prof. Bambang mentioned earlier today, these 4 areas in Jakarta which need urban maybe renovation, urbanization, renovation areas like in Tanah Abang, Manggarai, and also other areas. We can also come up with some plans about how healthcare can also contribute to be part of the development in those areas and for those sub-district areas.
Okay, Doc. How about if the proposal from ACZ come out from private sector like us, Mepada, because we will collaborate that area maybe with Intiland and Cikal and other. That's why private sector just only need support from government. After that, we collaborate, propose it to Kemenko. Kemenko will ask about the time and about the who is the developer and the investor and many others. If we can answer the questions, we will get the publicity. Like right now, from Mayapada, we will have. And as you know, RSBP Batam will manage by Mayapada in this year. Because of what? Because RSBP already in area of the Mayapada SEZ. That's why maybe if the government regional can support us to get about the SEZ, it will help our as a private sector.
I think this is one of the idea why the event comes up with today's discussion here, so that maybe we can further discussion. We have further discussion about the idea, and also to maybe ask for other new ideas about the investment in health sector in Jakarta.
So we should work together and persuade them. Ironically, I won't tell you who gave it to me, but I saw a plan from someone who's probably going to stand for governor, and it had a healthcare zone in Sumatra Park where I think RS Fatmawati is. And with land opposite owned by Jakarta Intercultural School, there's actually quite a lot of land there. And at that intersection, they were thinking of having a focus on healthcare. So there's clearly some thoughts going on about how to encourage it and where to put it in. You never know. Just have to keep on asking. Yeah, I think. Yeah. So what I want to do now, I want to open it up to the floor. Okay, I was given some questions to ask, but I'm conscious of time, and I want to open it up to the floor. So here's what we're going to do. I'm going to start with the ladies first. Okay, put your hand down. Any ladies want to ask any questions, and then we'll go on to the gentlemen. So 2 questions from the ladies. One over here, yep, and one at the back there, yeah. So just please introduce yourself, and then let me know who you want to direct the question to.
Thank you. My name is Wijaya. Sorry, I'm a bit cough. My name is Wijaya. I'm chairing for WTN Indonesia chapter, World Tourism Network. We're actually a tourism organization. We have 134 in 134 countries. I would like to really appreciate with this event. The initiative come from DKI for healthcare tourism. And WTN is having our summit after COVID 2023, and we're actually signing kind of MOU among stakeholders to really committed to push through this medical tourism together. So WTN is also signing an MOU with Indonesian association called AUMI, Asosiasi Wisata Medis Indonesia, to initiate what we call Indonesia Health Tourism Promotion Board, because I think the key for tourism is really in promotion. But of course, now we are preparing to build the service itself. So we have like 2 sector in IHTPB. One is the medical industry practitioners, and the other is tourism practitioners. So, this kind of event is fantastic. And I just would like to give an input if it's good.
As we conclude the Jakarta Investment Festival 2024, I invite you all to join us on our journey towards global city in realizing the modern Indonesia 2045 vision. See you at the next Jakarta Investment Festival.
Pak Harto ya, Orde Baru ya, before Reformation. Indonesia have Indonesia Tourism Promotion Board with a policy of 2.5% budget from local government. So, and it's fantastic because Indonesia Tourism Promotion Board at that time under the Minister of Ayub Afe, we have, that is a really public-private partnership. So, it's a government and the corporate in the tourism. So that is worked very well. And in the world, everybody have tourism promotion board. And, it's led by the government. The objective of the promotion board is, of course, like really promoting it, which is we don't have that after the Reformation. So that is also part of our agenda. But maybe if we can, because we heard Indonesia have the policy from the Dutch, which is it's separating the funds between government and the private. That's why the government have the breakthrough, like having special economic zone. So actually it's quite challenging for private sector to sort of like, because we have to market destination. We are not only market, separately. So this is the thing that I hope the KI, because Jakarta is supposed to be the leading city for healthcare tourism industry in Indonesia, I think. So I think the key is to have more consistent events to really put the resources together, because actually we do have fantastic resources among the practitioners. I hope we can, by working together, we can achieve the content that you're saying, how to attract this 2 billion market in Indonesia to sort of like start trusting their facilities in Indonesia. Thank you.
Thank you very much. Your last comment about trust is important. With so many people, Indonesians spending money overseas, there's clearly a lack of trust. Before we even talk about medical tourism from overseas, we have to win the battle in Indonesia. If you want to play in the Premier League at football, you have to win your home games. So we need to really build back the trust in the domestic market. And in my view, when I'm talking about medical tourism, I'm probably talking about tourism that people traveling from other parts of the Indonesian archipelago to come to Bali or Jakarta, rather than having any significant expectations for people coming from overseas, because I don't think that's going to happen in the immediate future. And I'll give you a simple example. Bumrungrad Hospital in Thailand, well over 85% of their doctors have been trained overseas. Island Hospital in Penang, well over 80% of their doctors have been trained overseas. There's not a hospital in Indonesia that even comes close to that. So there's an awful lot that has to be done here to build back, to regenerate the trust. And we're trying to do it as quickly as possible. But your point about working with the government is absolutely perfect. Anyone want to comment?
Yeah, I think you're right, Ainsley. We have to deal with the perceived lower quality of health in Indonesia first before going outside of Indonesia and capture the outside market. Maybe we can capture the tourists that are looking for leisure here to get the international standard kind of healthcare. But yeah, we can dream about it. It's always possible. I think you are right. The partnership, especially with the government, is very important in this case. We want regulations to be more streamlined, more consistent, especially with maybe the change of administration in Indonesia. The regulations should be consistent, not very complex for us to do this. Thank you.
Can I just ask, is this questions? I don't have my glasses, I can't read the screen. Is that questions coming through? No, nothing. I don't know what it is. Okay. Yeah. Is it someone's what's up? Is it a private what's up? Yeah, a question at the back here.
Okay. Thank you very much. My name is Susana Wijaya from Jababeka Group. Currently, we develop 4 areas, 4 cities in Indonesia, and we have 3 special economic zones right now. We started with our industrial estate area in Cikarang, Greater Jakarta, around 30 kilometers from Jakarta. Right now, we have more than 1,000 tenants, and there are more than 1 million employees working surrounding. Also, 10,000 expatriates. And we just made the medical school in President University, which is we want to develop international standard doctor to supply the whole Indonesia cities. And we are right now focused on development for medical tourism within our development in Morotai and also Tanjung Lesung. So I hope that you can give us some advice since we are experienced in develop industrial estate, but for industry, especially medical tourism, we haven't started yet. Now we are started. Maybe you can give me some advice, some tips to make it succeed. The same what we have developed in industrial estate. Thank you very much.
Susanna, is that right? Yeah, thank you very much. In fact, Ramono and Suteja are very close friends of mine. And I know actually Present University had a partnership or had some form of partnership with the University of Glasgow in my hometown. Right, so there's something developing there. Bobby, would you like to answer?
Okay. Yeah. Thank you, Thank you, Susanna, for the question. So, why we create the special economic zone for the wellness and hospitality? Because we know about the wellness destination, Bu. First, we have to know the wellness destination. So, why we create the special economic zone in Sanur, Bu? Because Sanur famous in the wellness, Bu. So the tourists can remember the Sanur is the wellness activity, like we have the legendary of hotel. So in my perspective, if we want to create the special economic zone and based on the wellness and hospitality, so we have to create the destination of wellness first, Bu, to create, and then after that we can create the ecosystem in the ecosystem. So that we make to the in the Sanur we make ecosystem. We collaborate with Bali International Hospital with International Hospital, and then we collaborate with International brand also. So and then in the presentation to government, we also present about my purpose, my company purpose to create the special economic zone, collaborate with top-notch brand, collaborate. We can use the special doctor from the board and the nurse. So in my perspective, for the create the special economic zone in Indonesian area. Thank you.
Thank you, Bobby. If there's $11 billion spent overseas by Indonesians in Java Baker and Java Barat, a lot of that money must be coming from there. All you need is one very good hospital, and it could be in Jakarta. To Jeffrey's point at Mayapari, you need the incentives. I think sometimes we talk about medical tourism when actually what we're really talking about is upgrading the healthcare infrastructure, principally. I believe we've got time for one or two more questions, so it's now over to the gentleman. Can you be very quick with your question and very quick with your answer? So we'll start with you. Very quick, one sentence.
Hi, my name is Rizal. I'm from Bocah Indonesia Fertility Center. I have a very quick three question. The first, just very quick, very fast. We'll be very fast. Okay, so the first question would be how feasible the medical tourism would be, because we've been studying also about the Malaysian healthcare, about the abroad for the treatment for the patient coming to Malaysia, and they have the very clear target on how to achieve that on 2025. So my question here is, how feasible are we achieving the medical tourism in Indonesia? That's the first question. And then the second question, with all the things, I'll just make it to that. With all the things that we have as of now, is there any quick plan that we are going to do to achieve the medical tourism just for now, as of now, with our condition? Thank you.
Okay. Thank you very much. Hello speakers, I am Dr. Yusa. I'm a personal assistant of Vice Deputy Indonesian Chamber of Commerce on Industry, Research, Innovation and Technology of Health. I want to ask two questions to Harmony. We know that IHC is one of the biggest stakeholder in Indonesia. May I ask with bahasa? Oke, I'm sorry. Jadi kita tahu bahwa stakeholder BUMN ada Kimia Farma, Indo Farma, kemudian ada IHC salah satunya yang mempunyai 36 rumah sakit. Nah, tadi izin sudah ada Mayapada, kemudian mungkin ada dari Siloam. Nah, bagaimana, saya ingin simpel aja sih pertanyaannya. Jadi bagaimana langkah IHC sendiri untuk dia menempatkan Center of Excellence di masing-masing rumah sakit. Nah, kita tahu bahwa misalnya kita mau ke Bali nih, kita terkait dengan medical tourism, kita nggak mau Indonesia ini hanya terfokus di Bali saja, tapi pengennya di semua tempat. Nah, IHC mempunyai peranan itu, mempunyai kesempatan itu. Kita tahu ada Kementerian Kesehatan yang punya rumah sakit khusus jantung, rumah sakit khusus otak, dan lain sebagainya. Tapi bagaimana langkah IHC terkait dengan strategi ini? Apakah sudah ada ataukah belum? Izin. Terus yang nomor 2 adalah terkait dengan industri, medical industry ya. Dalam hemat saya terkait dengan medical tourism sendiri bukan hanya terkait dengan ranah kuratif, tapi juga ke arah industrial or engineering alat kesehatan. Jadi apakah dari rumah sakit atau stakeholder IHC dan lain stakeholder lain sudah terpikir terkait dengan teknologi transfer office, di mana di sini kita tahu bahwa medical tourism bisa jalan ataupun bisa lebih berkembang ketika ada alat-alat baru yang diperkenalkan. Nah, ketika alat-alat baru itu di Indonesia itu hanya impor-impor saja, kapan kesempatan anak-anak muda Indonesia yang punya bakat ini untuk menginovasikan sesuatu? Nah, apakah dengan adanya kesempatan medical tourism ini agak lebih terbuka, lebih lebar lagi terkait dengan teknologi transfer office? Contohnya adalah besok ini Kadin Indonesia akan contoh inovasi untuk ini invertuitas contohnya. Kita udah punya barang, tapi barang tersebut sebelum diproduksi dia sudah tes pasar dulu. Nah, tes pasar ini kan harusnya rumah sakit yang ada di bawah kan. Oh, ternyata di daerah sini banyak infertil, maka kita di industri akan membuat obat anti infertil yang lebih banyak. Nah, contohnya seperti itu. Jadi teknologi transfer office. Thank you. I'm sorry.
Hi, Wijaya. I'm the Trade Investment Director from New South Wales Government, Australian Embassy. Just one quick question on nursing actually. What model do you prefer? Sending your nurses overseas, quick in terms of upskilling but expensive, or setting up a new nursing schools here with international capabilities, more affordable but it takes much longer? Just want to know which model are you going for DKI, Pertamina, Sanur as well.
On the feasibility of the medical tourism, I'll answer it. It's only feasible right now in very niche areas. For example, Australia has a long wait. If you want a hip replacement in Australia, there's a long waiting list. We can maybe do that in Bali. There's some cosmetic surgeries going into Bali. It's only feasible inbound from overseas. It's only really feasible and realistic in some niche areas. Quite honestly, we won't be doing massive promotions around Southeast Asia. We need to do it here. Question about the details.
Yeah. Also, I'd like to add more in the visibility of other hospital outside of our Bali International Hospital. We already identified that East Indonesia is already emerged with maybe nickel mining and everything. So we develop hospital with specialty services RSOJ Biringkanaya Makassar, which is more accessible for East Indonesia to have the specialty with excellent care in Makassar. So we started out with Pertamina Hospital, RSPT, back in 1972. Generally, all our hospitals have the cardiology as a center of excellence. Some have oncology as center of excellence. But since our captive market is Pertamina, the Pertamina Hospital actually said to be the best burn unit in Indonesia because the fire hazard is very catastrophic for Pertamina. So our unit is very well developed. It's said to be the best burn unit in Indonesia with a lot of good credibility. Thank you.
And would you like to comment on the nursing
On
school?
the nursing school,
I look
okay.
forward to your answer.
In my opinion, then maybe it is better if we develop the nursing school here in Indonesia. But because actually, maybe we do have some good nursing schools, but what we should improve is how the nurses, when they are working at the hospital or the health facility, then the ecosystem at the hospital or the health facility support the good quality of the nurse, so that the hospitality on the supervisory system, the reward and punishment system, and maybe those all things should be improved. Then we can maintain the quality from the nurse when they finish school until they serve the times at the health facility.
Thank you, Dr. Atabi. One word of caution on a nursing school. The NHS in the UK has a nursing school in the Philippines. So because there's a huge shortage of nurses in Europe, and even the Middle East and places. I heard in BSD they're maybe thinking of doing something like a nursing school. What I heard was their target market was to supply nurses to the Middle East. That is not what Indonesia needs. Indonesia needs the nurses to stay here.
I would like to add just one small information. Maybe we can also see that when the nurse from Indonesia work abroad, then they can achieve the good standard. They can set their standard as good as the other nurse from other countries. So it means that the education for nurse here is not it's good or enough, but the health facility condition when they work then should be improved. That how to maintain the good quality of the nurse also.
Thank you, Dr. Otavia. Thank you, Harmony, and thank
My
you,
pleasure.
Bobby. We are well out of time. One question morphed into two on a couple of occasions. But anyway, thank you very much for attending, everyone. I think we covered a lot of ground today. A lot of people are interested in the medical tourism, but I think in summary, we realize that actually what we're talking about is fundamentally improving the quality of healthcare in Indonesia for Indonesian citizens first and foremost, rather than immediately attracting people from overseas. Batam might be different because it's so close to Singapore, and Singapore is very expensive. So you might be a slightly different market in Batam. But and in terms of the special economic zones, they are a big benefit, but they are only addressing a very small percentage of the healthcare sector. And again, I agree with friends from Maya Pada. We need to be doing more to encourage more rapid expansion and more acceleration of incentives in urban cities like Jakarta. In a much more, in my opinion, on a much more general scale. So thank you very much, everyone. Enjoy the rest of your event, and I'll see you in the Valley Hospital. Oh, you want a photo? Okay, ladies, the photo. Bobby, you and I stand at the side.
As we conclude the Jakarta Investment Festival 2024, I invite you all to join us on our journey towards global city in realizing Golden Indonesia 2045 vision. See you at the next Jakarta Investment Festival.
On behalf of the Jakarta Investment Festival Committee, I'd like to extend our gratitude to all distinguished speakers, investors, business partners, and guests for coming and joining us at the Jakarta Investment Festival 2024. It's been an honor to engage with all global leaders in shaping the future of our city. Let's continue this journey together to build a stronger Jakarta. See you at the next Jakarta Investment Festival.
Thank you.